Hello, researchers. Let's talk about measuring the contents of your vial and your dosage. Let's say you're testing a product called E30. This means the vial contains 30 milligrams of the drug. If your protocol starts at 2.5 milligrams, this means one vial contains 12 doses, because 30 divided by 2.5 equals 12. If you are currently testing 7.5 milligrams, a vial of E30 would contain 4 doses.
I'm sure glad I ordered E30. I'm just getting started, and that means one vial can last me a long time.
Not so fast. While each researcher needs to determine their own risk tolerance, each time you draw medicine from the vial, you are introducing bacteria and risk creating a large hole in the rubber stopper. 28 days is the clinical guidelines, while many researchers feel comfortable going up to 6 weeks, as long as the medicine does not appear discolored, cloudy, or have any inclusions. Did you already buy E30? Don't worry, you have a few options. You could use a vial of E30 and use it for 4 to 6 weeks and then toss it. It isn't ideal, but still way cheaper than your retail options. Or you can hang on to your kit, stash it in the freezer, and order a kit of E10 or E15 to use first. How many units will give me my proper dose? The number of units that you need to inject will depend on the concentration of the medicine. That is to say, it depends on how much bacteriostatic water you use. Use a lot of water, you'll inject a higher number of units. Use less water, inject fewer units. The amount of medicine in the vial doesn't change. The concentration will change depending on how much bacteriostatic water we reconstitute with. The vial still contains 30 milligrams of our medicine. If my dose is 2.5 milligrams each week and I use 1.2 mol of bacteriostatic water, then I'll inject 10 units each week. If I use 2.4 milliliters of bacteriostatic water, then I would need to inject 20 units. If I used 0.6 milliliters of bacteriostatic water, then I would only inject 5 units. All 3 of these examples would give me the same amount of medicine. This is the same reason someone testing medication through a compounding pharmacy may find their directions change units upon a refill. While it is best to speak with your provider, know that it doesn't necessarily indicate a mistake. Always use an online dose calculator for reconstitution. In this example, we have the same dose of 2.5, and the peptide strength is the amount in my vial, 30 milligrams, so the only number we can adjust is the bacteriostatic water. In this example, I'm again using 1.2 milliliters and require 10 units. As my research progresses and I change the dose to 5 milligrams, I see that I will now require 20 units. We hope this overview provides a better understanding of each vial you are testing and how to determine the number of units required to achieve the desired dose. Good luck in your research.